Sleep apnea literally means without breath. It can cause fragmented sleep, shorter lifespan, reduced quality of life, and even death. It is estimated that left untreated, sleep apnea can reduce lifespan 7 to 15 years.
If you wear those elastics and you keep the bottom teeth moving backwards, the top can stand up more.
At Arizona Sleep Apnea Solutions, Dr. Paul Serrano specializes in obstructive sleep apnea testing and treatment.
If you're waking up several times in an hour, sometimes as much as 50 to 60 times in an hour, your body can never get to its natural sleep cycles. So then you don't get your REM sleep, you don't get your reconstructive sleep, and you wake up tired, and basically your body thinks that it's stressed all night long.
Basically, when you sleep, air travels through your mouth, down your throat, into your lungs. The narrowest part of the airway is at the junction, where the soft palate, the tongue, and the back of the throat all compete for the same space. When you are awake, the muscles are tight, keeping the airway open. But when you sleep, these same muscles relax, causing the airway to narrow. As the air passes through the narrowed opening, the uvula and the surrounding tissue begin to vibrate, causing a condition known as snoring. If the tongue continues to fall back, it can cause the breathing to become slowed or completely stopped. This is known as obstructive sleep apnea. More than 18 million Americans suffer from obstructive sleep apnea. 90% go undiagnosed.
Usually snoring is a telltale sign. People sometimes say, well, I don't snore. The wife says, oh, the heck you don't, you're snoring like a roller coaster.
A study from the Mayo Clinic found that spouses of snorers woke up at least partially an average of 21 times an hour, nearly as often as the 27 times the snorers woke up from sleep apnea.
The person that has apnea thinks they're asleep. The person that can hear them snoring and they're flipping over and over is the person that wakes up. So usually most of the interview we do at a screening is asking the bed partner, do they snore? What does it sound like? Do they stop breathing?
Other signs can include sweating during the night, fatigue during the day, morning headaches, suddenly waking up unable to breathe, waking up feeling tired, losing interest in sex, feeling sleepy during the day, falling asleep at work, school, or church, or while driving, restless sleep, tossing and turning, and concern that your quality of life is affected by fatigue.
Certainly the first thing is you're tired. So you wake up every morning like you've just had a bottle of wine. You have a headache, you're tired, and you can't get it going.
And the list of serious health problems is long. Obstructive sleep apnea is associated with an increased risk of cardiovascular disease, high blood pressure, diabetes, stroke, and arrhythmias.
The comorbidities are that people's blood pressure gets higher. Some of the things, other ailments that we treat now medically, what they call metabolic syndrome, a lot of them are related to the obstructive sleep apnea. I think the key thing is to be tested. The way we do home sleep testing now really puts a definitive thing on, at least you're not obstructing.
This is the home sleep study test, okay? And it's simply worn on your head like this. You get to wear this at home, in your own bed, in your own environment. And there's no plugs and all these different types of cords, and you get to wear it at your own time.
And you put it on, you go to bed, you drop it off, it's all downloaded onto a computer, it's uploaded to a pulmonologist and to a respiratory therapist that can read it, and then you get the results.
Along with the home sleep test, Dr. Serrano uses the latest technology to get a full picture of the patient's airway.
The cone beam CAT scan really is a phenomenal piece of equipment now that we can test just the upper part of the airway without exposing the whole body to the radiation, etc., and get lots of findings.
And if a patient has obstructive sleep apnea, the two most commonly used treatment options are the CPAP machine or an oral appliance.
So you're blowing air through the nose, it blows down into the throat and opens the airway up. So it's a constant air pressure, positive air pressure, CPAP, continuous positive air pressure. It's almost keeping the throat open by continually pushing air down it. It'd be like filling up the straw with air so that every time you suck, it doesn't collapse. So when people have that, it's an appliance that's been used for lots of years. It's very therapeutic. It has to be fitted either on your nose or in your nose, and maybe over your mouth with a mask, and it has a little motor that blows this air. And when people tolerate it well, it works great because it's using, I call it an air splint. But if they can't tolerate it, you got to find another way to keep the airway open, and that's where the oral appliances come in. If they've been previously diagnosed with obstructive sleep apnea with either a home sleep test or overnight study, and they've been resistant to using some of the primary therapies, which is a CPAP, or continuous positive air pressure, it's very easy to say, let's fit you for an oral appliance, which is basically you take an impression of the teeth, you take a registration of where you want the jaw to bite, a position, and you fabricate a device that can be worn.
The Academy of Sleep Medicine issued an official statement that a dental appliance can be used as the first line of treatment for mild and moderate sleep apnea and as an alternative to the CPAP for severe sleep apnea.
The therapy is to bring the jaw open like this, forward, hold it forward, so when you're going to sleep, the airway doesn't collapse back.
The oral appliance is comfortable and easy to wear. Most people take only a couple of weeks to adjust to wearing the appliance. It is small and convenient, and the treatment is reversible and non-invasive.
The oral appliance fits their lifestyle much better because people are used to wearing bleaching trays, used to wearing TMJ splints, used to wearing mouth guards, so it seems like they have a higher tolerance of wearing an oral appliance than they might have wearing a face mask.
The Academy of Sleep Medicine reports oral appliances are the #1 non-surgical alternative for CPAP intolerance.
If someone comes in, they say, I snore, I don't know that, get tested. Get tested and believe the science that when you obstruct at night, you obstruct more than 5 times in an evening, you're not at your full potential. That you probably got more energy stored up in that body than you think you did. It'd be similar to when someone gets their first set of glasses and they say, I can see. It's amazing when they get a full night's sleep and they wake up energized and without a headache, they're believers. This is real. Their spouses are really believers because now they can move back into the room. But the reality is they know. And people that have been treated for obstructive sleep apnea will tell you they don't want to live with either without their oral appliance or without their CPAP because it makes a difference in their day-to-day activity. Every patient that has been diagnosed with obstructive sleep apnea that gets something to make it better, you're their new best friend because reality is it changes their life.